Morning, good afternoon, and good evening to all those joining. And welcome to session 3 of the This is Public Health TIPH Global Final Showcase webinars. My name is Robert Otok, Director of the Association of Schools of Public Health in the European Region, ASFER, and a member of the Global Network for Academic Public Health. And I will serve as your moderator for today. Please feel free to submit questions for our presenters by using the question and answers button. We'll save questions for after all presentations. The This is Public Health, or TIPH in short, Global Grant Program, generously supported by Dr. Richard and Ms. Linda Rigerman, provides awards to academic public health institutions around the world to develop campaigns that increase the visibility of public health and promote awareness of public health issues, education, and career opportunities worldwide, with a specific emphasis on local communities. The second cohort of TIPH Global awarded grants to 12 academic public health institutions from 10 countries. And this is session 3 of the virtual showcase, where you will hear from 4 of our cohort 2 grantees about their projects. You will be able to access recordings of all sessions on the Global Network site. And now I will turn it over to Carl Conyard from University College Dublin in Ireland to begin the presentations. Thank you. Carl, the floor is yours.
Thank you, Robert. Good morning, good afternoon, good evening to everyone watching. So my name is Carl Conyard, and I am the TIPH ambassador for UCD and on this project called Towards Harmonizing Education in Applied Infectious Disease Epidemiology in Master Level Public Health Programs, specifically on the value of an ECDC self-assessment tool. So we'll move on, and the true vision of the use of these core competencies was to really portray the use and ease of a useful online self-assessment tool for academics. And throughout the process, we've been very lucky to portray the project at many different high-level meetings across Europe, both in Ireland and within Europe. And it's been very, very important. We've been able to present at the National Royal College of Physicians in Ireland scientific meetings, as we can see this poster here, which presents all elements. And then we also got to present at the World Congress as well back in 2023. Fantastic. Now, which details the framework, really showing that we have 6 subject areas here, 26 domains. And for the purpose of this project, we took the 3 most relevant subject areas in alignment with infectious diseases, and from that, these have comprised 12 domains. And as we move on, we'll move on to our literature review. And as we can see here, we began with a very clear and detailed search strategy, which led to a multi-model process in which over 290 publications were screened and assessed, culminating in 60 publications which were of use within the project. And from this review, 6 studies were seen as being really key. A sample of the 5 are shown here within our review table, noting the year, the competency lists assessed, and the methodology and key findings found. And it must be noted that this work was co-carried out by an amazing master's student and will contribute to her master's dissertation. We'll next move on here. We can see the original ECDC self-assessment tool before completion. And as we move on, there are some strengths and limitations. And some of these strengths, it's easily accessible via a QR code, it's easy to use within your downloads, and it has good visual impact as well, and it's confidential to the individual. And it also links to really good training resources as well. But there are some really key limitations here as well. The proficiency levels are not really well defined. Visual representation only, there's no score provided to really give key meaning. And it's not possible to track one's progress through the domains or competencies. And it's also not really functional for educators or trainers who may wish to use this to really assess how their program is doing and how good the teaching is. So as we move on...
Carl, could I just bother you one moment to just put it into presentation mode for us, just so we can see the full screen?
Apologies.
No, just so we can see it better. Thank you so much. Appreciate it.
No problem at all. So as we can see here, as part of our methodology, we redesigned these data collection instruments. And as I said previously, we really keyed in on these 3 subject areas, which comprise 12 domains and 91 competencies. And it was really, really important for us to really get to the strengths of these. An ambition of this project was to engage programs of public health. And to that end, 3 of the targeted schools replied, favorable, but do not run public health programs with this content currently. Of these, 2 institutions are currently setting up programs. And now knowing about this amazing tool, they intend to use it within their program planning going forward. One institution has a bachelor's program broadly related and are willing to participate in the next academic year. And there are 2 institutions who have master programs who have distributed the survey to their students. Now, as we move on to some examples of results, we can see here a really nice example, really demonstrating a commendable shift towards increased knowledge and skills of students at the end of a program. But when we look at the next result here, we see a result which we could say indicates some future development of the course materials and development of the course or that module in particular. Now, as we move on here, we can see a summary of results by domains. And we have our domain codes to the left-hand side. We have the titles of the domains. And within the parentheses, we actually have the number of competencies which are applied within. From that, we're very lucky that these scores are based on a 5-point scale, from unaware being the lowest score of 1 to being an expert at the highest score of 5. And provided are the medians and ranges of the pre and post program scores for each domain. Now, looking at this descriptive information, it's really clear that there's a truly significant shift of higher levels of competencies in knowledge and skills and post program, all of which are highly statistically significant. And the same holds for both A, B, and D domains, which is amazing. Now, as we move on here, what are the contributions of this project? And this is very important. Importance of self-assessment, program assessment model for other areas of public health education, development of online toolkits which can be used by schools across both Ireland, but across the European region and across the world, and the basis for modification of teaching programs and practice to harmonize teaching in public health across programs and schools. Also, of use for public health dissertations and dissemination of presentations and publications. And also this work has really contributed to the EASP for WHO core curriculum program for public health. And just to express further, here's an example. I can see many names I know very well here in our webinar here today, and many people have been a part of this process, and a gigantic thank you. But to really look at where infectious diseases really link into this core curriculum, everywhere highlighted in red shows a connection. But even for an even more simpler view, let's have a look at this. So this is a connection map which was generated using content analysis. And as we can see here, we have all the different subject areas within the core curriculum and seeing the connection of communicable diseases throughout them all. And as we can see, the thickness of the circles and the connection arch shows that interconnection. So as we can see, infectious diseases is very important. Skills and knowledge is crucially important for future education of public health practitioners. Thank you very much. Mila Boikis, as we say, Oscoilga, and thank you to TIPH and to the ASPPH for this amazing opportunity. Thank you.
Thank you very much, Carl. Also, thank you very much, to all of your team that contributed to this project. I mean, it sounds like a lot of work. We're doing well with time, but let's move on, to our next presentations, and at the end, we'll have time to answer questions and perhaps, discuss some matters. So our next presenter is Alexander Stevanovic from the University of Belgrade in Serbia. Please, Alexander, the floor is yours.
Thank you, Robert, and greetings from sunny Belgrade. It's an honor and a pleasure to be with you today, and thank you to the association for giving us this opportunity to conduct our project titled Public Health Cinema. So my name is Alexander Stevanovic, and I'm teaching assistant at the Central School of Public Health and Healthcare Management here at the University of Belgrade Faculty of Medicine. So I just first want to say a big thank you to the core team of this project, Professor Aleksandra Jovic-Vraneš, Jovana Todorovic, Stefan Mandic-Rajčević, all colleagues of mine. It was really an honor to be with them on this journey, and I hope we will continue to collaborate in the future. Basically, our project is around health promotion, and we wanted to try a new approach to health promotion, an old and refreshed way of promoting health, of communicating risk, and talking with our young adults here in Serbia. There are many papers already published around having movie screenings as a method of teaching and health promotion. And of course, you might know some of the initiatives of WHO about the Health Film Festival and so on and so on. So we piloted this idea 2 years ago with our medical students. This was our first, I would say, a little project called Words Also Heal. We had 6 movie screenings followed by expert panel discussions. So each topic was linked with an expert panel discussion talking about the main points regarding health in that movie. And we had over 500 students at that time coming and hearing those discussions and talking about the issues they want to talk about regarding their health and well-being. So, for example, some of the titles were the Flight Over Cuckoo's Nest, of course, All About My Mother, a Serbian movie very famous about Variola Vera, Patch Adams, and so on, Erin Brockovich, Girl Interrupted. You might know these titles. If not, I warmly recommend you to Google them and maybe to see some of these exciting movies. Then the second cycle of these movie screenings came called A Brave New World. I'm not going to go into details, but we had excellent feedback. So we decided we should kind of brand ourselves. And this is where This is Public Health Project helped very, very much. So this is our official brand now called Public Health Cinema with this logo, kind of connecting arts and health together. So what is interesting about here? Of course, there is this possibility of raising awareness around certain topics, but also it's two-way street. So we also get to hear what are the concerns of our public. So we want to identify those, do this kind of community engagement, and also provide high quality health information to them by inviting expert panelists, expert guest speakers to our movie screenings. And this is exactly what we've done. We had 4 movie screenings. You might know this one, Mommy, of Xavier Dolan from 2014. Then a Serbian movie called Oasis. It was our candidate for Oscars. So these were movies mainly concerned with mental health and well-being of our young adults. There was also a movie called Golden Boy, also about substance abuse and mental health. And then Day After Tomorrow, this is one that is maybe a little more famous about climate anxiety and climate change. So these are a few moments from indoor and outdoor movie screenings. You can see the public, the audience, you can see the movies getting projected. Sometimes the weather allowed us to go outside, sometimes it didn't, so we had to be indoors. But in anyhow, it was very engaging and we had excellent feedback. Of course, these are our social networks. You can follow us there and see this project in more detail. So photos, news, events. If you're coming to Serbia, maybe visiting beautiful Belgrade, come to one of our screenings. We're currently on Facebook, Instagram, and LinkedIn, having over 500 followers and over 300 in-person attendees. We also participated and presented our work at the European Public Health Week. So the event title was Public Health Cinema, a new approach to health promotion, where we showcased what we've done and what are our future plans. And these are some photos also from this event. You can see Faculty of Medicine and many of our colleagues, journalists and policy makers present at this event. Finally, on our journey, we have made friends and valuable partnerships for the future. We collaborated with City Institute of Public Health. A big thank you to Yugoslav Film Archive, Faculty of Dramatic Arts in Belgrade, many more movies and film centers. And we hope to continue doing this together in the future. Here, I have put our contacts if anybody wants to reach out. And of course, we stay open to your questions and comments and ideas. Again, on behalf of the Center and School of Public Health and the whole team, I really want to express our gratitude for being part of this journey and, for having this opportunity to make our idea a reality. And thank you for that.
Excellent. Thank you very much, Alexander. It sounds like a truly exciting project. And since we reached, halfway through our presentations, let me just remind you that all of you joining, can submit questions at Q&A, that Q&A that we will have time, it looks like, nicely addressed, following the following two presentations. So again, thanks to Alexander. And now our next presenter is Jose Antonio Marin Rodriguez from the Andalusian School of Public Health in Granada, representing a joint project with the University of Granada in Spain. Please, Jose Antonio, the floor is yours.
Okay, thank you. Let me accept. Perfect. Good morning, afternoon, everyone. I'm Jose Antonio Marin, the TIPH Global Ambassador from Granada, but I'm going to talk as we, because we are AMR Reduction, a team of public health professionals driven by a set passion to combat the growing threat of antimicrobial resistance. We believe that empowering healthcare professionals and the public with accessible, up-to-date information is crucial in this fight. Originating from a collaborative classroom project at the Andalusian School of Public Health, our team unites diverse expertise in biology, epidemiology, anthropology, health science, and medicine. We leverage our combined research, communication, digital health, and advocacy skills to raise awareness and effectively educate about AMR. We focused our efforts in Granada, Spain, aiming to understand and address the local challenges of AMR. Our research identified a crucial need for a centralized, accessible resource providing tailored information to both healthcare professionals and the general public. To ensure our project effectively addressed local needs, we conducted a robust field study, gaining ethical approval and collaborating with key stakeholders. We conducted in-depth interviews with 12 medical residents in Granada to better understand their needs and ways of learning. Additionally, we surveyed 60 healthcare service users to understand their existing knowledge and preferred information sources. Our research revealed a significant knowledge gap around AMR among both healthcare professionals and the public. Medical residents expressed frustration with fragmented and difficult to access information. The general public demonstrated a need for clear, concise information about AMR and its implication for their health. These findings reinforced the necessity for a user-friendly, centralized platform. To bridge this knowledge gap, we developed AMR Reduction, but I want to show it live because I think it's more self-explanatory. This is our platform where you can see like a little bit introduction, but the important thing is here in the AMR back page, where you can enter as a professional healthcare provider and get a lot of resources. This platform offers curated resources, regularly updated articles, guidelines, and research of NMR and antibiotic stewardship, tailored specifically for medical residents and the general public. Interactive learning, engaging content, including videos, infographics, and frequently asked questions, making complex information easily digestible. Local information leads to relevant organization initiatives and events happening in Granada, and also contact information, easy access to local experts, and resources for further support and guidance. We believe in the power of engagement and dissemination. Beyond the website, we actively disseminated our message and findings through various activities. The ASPER conference presented our project in the ASPER Deans and Director Retreat and the ASPER Young Researchers Forum, reaching over 150 public health leaders and experts across Europe, earning us the Best Poster and Communication Award. The European Researchers Night engaged with over 200 community members through an interactive hunting gene workshop, emphasizing the link between hunting gene and AMR prevention. Also, a social media campaign reaching over 7,000 accounts on Instagram, Twitter, and LinkedIn, raising awareness and directing traffic to AMR reduction website. And finally, we would like to share AMR reduction to us in an experience where we, as public health students, were able to put into practice everything we were learning while studying. Therefore, it has been an experience gaining and a field experience. We are incredibly proud of the impact AMR reduction has already achieved, but our journey is just the beginning. We are actively seeking collaborations to expand the platform reach and different features, including developing tailored informational modules for medical doctors and implementing a chatbot for real-time information access. We invite you to visit our website, www.amrreduction.com, and join us in the fight against Max. Thank you, and come with your question. I encourage you to connect with us.
Thank you very much, José Antonio. Again, an excellent presentation. I mean, like, it's nice, to see the variety of topics and also methods applied, like by the teams, from this year grantees institutions. So excellent. Thank you. I again, remind, since we have one more in the presentation to go, please do not be shy and ask questions, once you hear the presentations. And we'll open the question and answers session following the last remaining presentation that will be delivered by Paulina Dera from the Medical University of Gdansk in Poland. Please, Paulina, the floor is yours.
Okay, so hello everyone, and thank you for having me here today. So as Mr. Robert Otok mentioned, I am Paulina Dera from Medical University of Gdansk, and I'm also a student ambassador of This is Public Health program, and I'm a second-year student of PhD. So our project was about everyday life in the face of war as a current public health hazard. We chose this topic because, as you know, as we all know, that the most problematic situation in problem was due to our neighbors, the Ukrainian people, and they needed to face the war in their territory. So our partners in the project from Poland was Jagiellonian University Medical College, the Institute of Public Health, two of the high school here in Gdańsk, and National Center of Fetal Culture in Gdańsk. From Ukraine, we was partnered with the National University Ostrog Academy from Ukraine. And when we talk about the European partners, it was, of course, undergraduate network of ASPER. And our following content, among others, was impact of war on public health, stories and points of view for better understanding the problem, opportunities to help immigrants from Ukraine, and current healthcare situation in Poland in context of the influx of Ukrainian refugee patients. Our main goal was to raise awareness about this widely understood migration problem, and the final outcomes was increased awareness about this problem and the hardships faced by immigrants, a better understanding of them, establish new contacts and building experience, and of course gained new opinions from the perspective on young people. Why young people? Because we encourage a lot of students from our university, especially from a public health circle, and the young people from the high schools, and we encourage them to provide some kind of ideas for Instagram posts and so on. So what was our impact statements here?
Paulina,
Yes.
sorry to interrupt you. Is it possible for you to put this into a full screen presentation mode? If not, it's all right. We can see everything, but right now it is in a note format.
Okay, because I see it like a full screen presentation. Okay, I will try it again maybe. So wait. Okay. So is it better now?
I believe so. Yes, thank you so much. I appreciate it.
Okay, so back on track. Okay, so the impact statement, we had a few of them. Of course, I will not tell you about everything, but first of all was the fostered empathy and understanding towards immigrant populations and leading to more compassionate and effective support systems, and contributed to ongoing efforts to raise awareness and advocate for the needs of immigrant populations, both locally and internationally. So what was our activities due to our project? So first of all was our health stand in local initiative, because we believe that when you want to provide an effective activity and effective product, you need to be a part of the society, and would like to build new experiences for them and new contacts with the local society. So we provided this health stand, not only about our project, but also we encourage people to be more awareness about public health by itself. And the second one, of course, was our Instagram account. And we, due to this is public health program, we made a new logo for this initiative and for our Instagram. This is a modern public health, and we provided the posts about, of course, our project, but also about public health overall issues, problems, and any ideas how to make a solution for some, and so on. So this is kind of example of our post. Here it was about the PTSD Awareness Day and what it is and why it's important due to our project. So next was involvement in conference, Gdansk Health Days. So it was provided by our Medical University of Gdansk, and we was a part of it in providing this conference and be a partner in this initiative. What's more, we made some kind of contacts with other people from our university, and we involved in meetings and preparation of leaflets for intervention grant, improving migrants' access to information on vaccines in the Tri-City. Because maybe, as you know, we have some kind of differences. I mean the Polish government and Ukrainian government due to the vaccines and vaccination by itself. So the project was about to awareness the Ukrainian people about their possibilities to get some vaccines as the Polish citizens. So there was some kind of meetings, as you see on the photos, the online meeting as well, and we provided these leaflets with the QR codes to the most important websites for the immigrants about the vaccination, for example, for COVID-19 or some vaccination for children. And next activity was the contest for the high school students, and that was based on their ideas for the Instagram posts, and they provided some kind of post on our Instagram account, and they receive after all the vouchers, gift cards for their help in our project. And at the end, I would like to briefly summarize everything. So I would like to share you the information and our, in my opinion, the most important statement that the money isn't the goal, the freedom is. And a lot of people previously came to Poland from Ukraine to get a better life, better financial status. But of course, after the war, the most important for them was the freedom and the peace. And they were very grateful for our help, for the help from Polish people, Polish government, and so on. So we would be very grateful for everything that they have done also in Poland. And I think that we will be a best maybe friends in the future, and we will be very happy with each other in the same country like in Poland. So that was all from me, and I would like to thank, of course, all of you for being here and all of you for having me here today, and we are very grateful for receiving the This is Public Health grant. Thank you.
Thank you very much, Paulina, for your nice presentation and, of course, the important topic also that was brought by you and the team in Gdansk, on the agenda of this year's TIPH program. So we will now start the question and answers, and since there are still no questions posed, I will let myself, to ask you first myself. So just to start, let me perhaps all of you ask one question that some of you addressed already pretty well, but it would be nice, to sort of, structure it now one by one. And the question is, other ways you would like, to see your project or work expand in the future. So there is also that kind of a question on sustainability of the work that you've done. And so if you're okay, I mean, we can go with the same order as the presentation followed, so I would ask first, Carl, please.
Thanks
to
again, Rob,
reflect.
and thank you for that really interesting question. One of the things that really jumped out with being in contact with all of the schools was the need for such an important toolkit really available for academics across the breadth of public health. And really going forward, I see it being very, very useful in developing new public health programs to ensure that they're up to date, for want of a better word, but also evaluating existing programs for the following academic years as well. And really, for me, with my work on the CCP and ASPER, this also ties in as well, ensuring that it helps for future development of future toolkits to assess curriculum, to assess how schools are being able to ensure that skills and knowledge they are imparting to students are just what students need for the workforce and for public health, most importantly. So that's really my words on that.
Thanks, Carl. Yes, I mean, like, I definitely, see the relevance of your work, into like, expanding within also ASFER, across, the mentioned curriculum program, but they also in the wider professionalization of the public health workforce agenda, to move forward. So it's really great. I mean, it's also nice, how implementable it is, in a way, for the new website of the association, but also, like with the links, to the website and directory of the Global Network for Academic Public Health. So that is a nice impact that certainly your work will continue to have, and will try certainly make ways, to make it visible. So then, if I may ask the same question about, expanding in the future, the work you've done more locally, Alexander. I can see, I mean, your project being an exciting kind of a startup thing, but would you, and then you did mention about, like some other similar method-based type of initiatives by WHO and others, the more international scale and so on. But would you think about, I mean, which way you would like, to kind of go? Tell us, please, Alexander.
Thank you, Robert. Well, we made many partnerships exactly for that reason, to try to become sustainable. And we applied to our Ministry of Culture for future grants to support this idea. But also many government and non-government organizations became sort of our colleagues and friends on this journey. But the most valuable thing I would say is this direct feedback of young people who are saying, this is interesting, but go further, meet us where we're at. So not indoor screenings in some classy institutions and so on, but parks, riverside, nightclubs, beaches, and so on. So where they want to receive this information and how they want to receive it. Pick the right communication channel. They said to us, okay, Facebook is cute, but we're on TikTok now, and so on. So you kind of have to constantly, try to be in the moment and to listen to them. And I think we're going to keep on asking them, where do they want to watch public health cinema? And hopefully we're going to reach out to other communities, not only in the capital of Belgrade, but also non-urban places where all this culture content is not so abundant, like in the capital. And this is exactly what public health cinema is all about, bringing high quality health information, but also bringing culture and arts to those who want that sort of content, making it attractive. And yeah, hopefully we're going to continue doing that in the future.
Exciting, Alexander. Definitely. I mean, like, and again, I mean, like, I can think of some ways that both, the association in the European region, but also the global network, I mean, could keep supporting you and connecting, with relevant other colleagues and institutions, that you could kind of show your work and collaborate perhaps, further. We had several projects in the past, that were operating also, through the sort of either the film festivals context or like the repository, of the movies and films. I would be very happy to share those with you as well, because that could actually help perhaps, your initiative locally, but also, connecting at the European and international level. So this is excellent. Thanks, Alexander. I've been always a fan of your work since we met earlier last year. Perfect. Thank you, Alexander. So Jose Antonio Rodriguez, could you also tell us a few words about how you see your work, your project in Granada expanding and continue?
Certainly. The Project Multiresistencias has made significant strides in combating antimicrobial resistance through research and educational initiatives. But looking forward, we vision several expansion avenues for this project. The first one is a broader geographical reach. While our efforts have primarily focused on Granada and surrounding regions, we aim to extend our outreach to other parts of Spain and eventually across Europe. This would involve collaboration with more hospitals, universities, and public health institutions. Also, we want to enhance our digital presence. Developing an advanced virtual platform is a priority. This includes integrating the AI-driven chatbots to provide real-time information and support for healthcare professionals and the general public. And also, although this wasn't feasible initially due to staffing limitations, securing additional resources and expertise will be pivotal. We also need to increase stakeholder engagement. Expanding our network of stakeholders is crucial. We plan to engage more healthcare providers, policymakers, and international organizations to foster a more collaborative approach to tackling AMR. Also, the development of educational programs, launching comprehensive educational programs targeting various demographics, including school-age children, medical students, and the elderly. Tailored workshops and iterative modules will enhance understanding and preventive measures against AMR. But last but not least, the funding and sustainability. Because securing sustained funding to ensure the project's longevity and the continuous updating of educational content and research is fundamental. So establishing partnership and seeking grants from the international health organization will be essential for this task.
Many thanks, Jose Antonio, and I can also assure you, of course, of the support, that we could provide you here from the kind of a more Brussels perspective, also in the relevant policy contexts, the relevant platforms and stakeholders, particularly now relevant, following the most recent EU elections, that we had yesterday. I mean, the last couple of days, so that to make your work and efforts visible. Since that is really an excellent way of also enlightening, the politicians that sometimes, under, like some pressures, from other side, and having them seeing and following initiatives like yours may be quite refreshing for them. So now, thanks. So to Paulina, the same question, and then we move to the next round. Thank you, Paulina.
Yeah, so I think that due to our project, we have made a great base in our, for example, social media activity, especially in our Instagram account. And I think that all of you from our team will agree that we would like to move forward about not only the war content public health posts, but of course the public health post by itself. And we would like to share awareness about this topic too, because in Poland, for example, a lot of people are not aware what exactly public health is. And when we would like to share more information about public health, first of all, we need to make a definition and be sure that all of the people from Poland will understand us. And another thing, it will be that we would like to make the partnership in the future with the same people from our university, because we are thinking that there was a great example that we can, get with everything together, and this will be a great opportunity in the future to make some partnership as well. So yeah, thank you.
Okay, and I see your mentor Lukasz raised hand, so perhaps Lukasz, you can add.
Just a short comment, because this project has also made us aware of importance of migrant health issues. Let's say the subject that was not so present in our curriculum, public health curriculum, because we were rather more, closed country with not many migrants, and this project, give us stimuli, to think of it and to include more migrant health issues into the also curriculum of our public health program. So it's a great value for us. Thank you very much.
Thank you, Lukasz. An important point. I mean, I'm very sure well noted also by colleagues from UCD who are also leading on the ASFRA core curriculum. I can also reassure you, following that work, that the migrant health, is high on the agendas and reflected in their work. We also have some exciting plans, within the region here to sign some important agreements with International Organization for Migration and continue the work in that respect. And what Paulina mentioned earlier, I mean, what is better than actually like explaining what public health is, if that remains, a fairly unknown yet, concept, to the kind of lay audience and public, if not, by presenting it, through the context that we all experience, and particularly in your country, neighboring, the war context. I mean, like, and the migration waves also, like it's been no doubt, an excellent way, to show, let's say, and to raise, the public health flag and the schools and programs community, both from the regional network and the global network for academic public health, making the program also visible and successful. I will have one more short question, to you, but again, let me check. Still no questions, from the audience. So I will ask that, but as the very final one, I would like to encourage, all four the presenters to perhaps think of a question that you would like to ask another group. Because you from the inside, running those projects, perhaps, any of the other, like interest you, and then, like would like, to ask such questions. So we'll leave that, to the final round, but just before that, so to give you time also to think who you want to ask, and perhaps, one person will get all questions, that would be also a bit of a kind of a voting for popularity, kind of. But I have a kind of a straightforward question, but it's perhaps nice to reflect as well. What was the biggest challenge or lesson learned that, you learned, with your team while working on your project? And perhaps, like an additional one to this, were there any moments where you could feel like, being challenged, that you kind of see the moment of success or the breakthrough that, you said that that's been actually the particular breakthrough, like in your work, in the kind of impact that you made, or the success you made with your work. So please, again, I mean, like maybe we start from Carl, you. Thank you.
Of course. So in regards to our project, really, it was actually really encouraging that students were very happy to jump on board to actually carry out these surveys, which is really, really interesting. Because sometimes getting a good response rate from the student population can sometimes be quite tough. So we were very happy with that. But on the other end of the scale, it was also really encouraging to see that schools and public health were really, really interested to really be a part of the process across the island, which is absolutely fantastic. As per usual, as I said in the presentation, like getting that buy-in from schools was very much a mixed model, because some of them haven't really developed a program yet. Some have a program, and some the program isn't where they wanted it yet before they actually have a look at it underneath the microscope. So with that, it's really laid the foundation for future work within the area, and it's really great moving forward. In regards to so I've hopefully addressed the challenge they're trying to get is a big enough response rate, and also a sort of success at the same time. Really just getting everyone together around the table and everyone happy to be a part of the process. So hopefully that answers both of those elements, Robert.
Thanks, Carl. I'm sure that, the visibility, like that the work at the European level, brought, I mean, like you on the spotlight, and UCD as well, helped, to make this work that you also run more locally, like popular and showing impact, in the broader context. Also now, at the global level, with the TIPH program. So thanks, Carl. And we value your work, in the association here enormously. So thank you. Alexander, the biggest challenge, and perhaps, like some breakthroughs that you experienced. Please tell us.
Oh, the challenge. I think the main challenge is doing a project in the area of health promotion. In all honesty, even today, 40 years after the Ottawa Charter, you still have many professionals, even our colleagues, who do not believe in the power of health promotion. Like, it's obsolete now in 2024. And I'm completely on the other side. I think it's more important than ever having these community engagement activities. And, these small projects then slowly driving us to a change that is needed. Because, when we think about vaccine hesitancy as a problem in young people, we see that as something very important and so on. But when we have this, for example, small projects that you want to pitch to the stakeholders, called public health cinema, for example, suddenly they're like, should I invest maybe in a machine or something more, concrete and solid? So this is the biggest challenge, actually, convincing policy makers and those who have the power and money to fund you that health promotion works. And that is very important. And it seems like we kind of maybe forgot how to communicate with the people in the end. And trying to push these projects today, it's not easy. But still, I don't want to discourage anyone to try. We tried, and I think we succeeded. And now we're in position, actually, to negotiate more for us and for our cause. But it was a long way. So for anybody being interested in health promotion, just don't burn out, and your win is closer than you think. But you need to take care of yourself, and you need to be patient.
Right. Thank you, Alexander. Wise words. I mean, and in your cinema project, I mean, can you think about any kind of a moment of particular success that you thought like, oh, that actually worked, that made us kind of like visible, successful, and about, those kind of breakthroughs, perhaps in the particular screening that you made, or like, was there any, I mean, like showing of the movie or whatever? I mean, like, was there anything like that? Or was it like, basically just the concept, the effort of your team that on the regular more basis, made it all work?
There is usually, in most of the screenings, there is usually this after, so it's either before or after, where the expert panelists start to talk.
Yeah.
And usually the audience is very shy at the beginning, but then maybe after 5 to 10 minutes, then you see the discussion going on, and suddenly you cannot contain it. And what happens, usually we end up staying over what we intended to say. And this is when, for example, discussion lasts for 45 minutes or 1 hour, and we envision it for 30 minutes. I say, okay, this was a hit. There are concerns that need to be addressed. We need to do this again, because it's only, for example, maybe 50 to 100 people per screening, and we need to reach out more people. So it's always this kind of, you feel exhausted, but still you feel very glad that the audience responded well, and that you managed to give this very valuable information regarding, for example, mental health, communicable diseases, healthy lifestyles, whatever it is for young people. Nowadays, especially, this is very important.
Thanks, Alexander. Jose Antonio, tell us about like your biggest challenge, and perhaps some moments of particular success, breakthroughs that you experienced in your project. Thank you.
I want to start with the lesson, because our primary lesson was adaptability. We learned to be flexible and adaptive. That's because we faced so many challenges during this year. One of the biggest challenges our team faces was managing the complex budgeting and accountability system with our institution. This complexity indeed in the timely utilization of the grant funds, necessitating the project team to initially cover expenses out of pocket. But we have learned, and also our institution has learned, so the future projects will include more robust financial oversight. Also, a big challenge was the technical expertise because the initial plan was to integrate an AI-based chatbot, and we see that it was not feasible due to a lack of in-house technical expertise. This highlighted the need for a diverse skill set within the team or access to external technical resources. That's why we get in our team a web developer, and that's why we have now this platform. Also, the coordination with the stakeholders, because coordinating with them, including hospital and professional, posed logical challenges. So effective communication strategies and regular updates are essential for a smoother collaboration. And finally, the community engagement, because engaging medical residents and the general public through digital service proved to be really challenging. However, the personal interviews provided valuable insights, and that teach us that mixed method approaches can yield better results in research. Through this experience, we've developed a more resilient and informed approach to project management, and we are ready to tackle future challenges with greater efficiency.
Thank you, Jose Antonio. I mean, that sounds like a very well thought and analyzed kind of mapping of challenges and how you trying to cope with them. And I'm sure also they will be well reflected in the reporting of individual teams. The community engagement context, the techniques that you used and how useful you found them effective. I mean, it's extremely important, for these programs and also the future grantees. So that's certainly very useful in all your experience in that respect. So thank you, Jose Antonio, and we move to Paulina.
Okay, so I think that due to my project about everyday life in the face of war, the biggest challenge was a meeting with the high school students, because a lot of us can be aware how the teenagers can act due to some lectures. And at first it was kind of difficult to provide the lecture, but after the discussion and after telling them what exactly is the public health and why the war situation in Ukraine is the part of public health problems, that was the breakthrough after it, because they understand what is going on and what they need to do. And after all, they have made a lot of great ideas how to encourage other people to it and how to explain other people what is going on in Poland and what is going on in Ukraine and how our countries need to cooperate in this situation. Yeah.
Thank you, Paulina. I'm sure that, with your activities, targeting high school students, I mean, you contributed to a larger number of public health students, both undergraduate and hopefully also, further postgraduate levels and successful future leaders in the field. So that's great. Thank you. I didn't ask the question about the methods you used, to reach out to your target audiences. As Paulina, you kind of indicated now, it was quite well reflected, in all your presentations, but that will also be part, of the material that will follow from the cohort 2 reporting context, that I'm sure that for the future will be very informative for others. So I promise, like an opportunity, we have 2 minutes remaining. So if there are any burning questions, of any of you to another presenter, we may perhaps, take 1 or 2 only. I promise all of you. So I mean, if all of you want, I mean, like, we will not stop. But please, I see Mary raised hand. Please, Mary.
Yes. Thank you very much, Robert. And first of all, I want to say congratulations to all the presenters. Those were great presentations and all really great on time and a lot of good information. I think this question is relevant to more than one, possibly to Paulina, possibly to Alexander also, maybe Antonio or Jose. We noticed in COVID that in the migrant populations that they didn't really follow the advice, the COVID advice or the health promotion advice that was really directed towards a national population in our context, and most of that would have been in English. And it became clear that they weren't following this advice because they were not listening to our national radio, TV, whatever, reading our national literature. And I'm wondering how you see the work you've done being accessible to migrant populations. And maybe you already mentioned the need for translation and things.
Okay, maybe I can add something from my perspective. So, especially due to our project, the partnership with the people from our university that receive intervention grant improving migrants, the access to information on vaccines in the Tri-City, there was a big breakthrough to the situation of the people, because we saw, as you said, after the pandemic and due to the pandemic and the COVID-19 vaccines, for example, the Ukrainian people had lower percentage of people who were vaccinated. That, for example, was in Poland. And after they went to our country, they were not specially encouraged to make the vaccine for the COVID-19, but due to this project, the intervention grant improving migrants, and we saw that they were very encouraged to get information, especially about vaccines on children, because they don't have much access like in Poland, in Ukraine. So they wanted to get more information, and a lot of parents get the vaccines for their children after these meetings due to this intervention grant. So yeah, that was great from our partnership with other people from university.
Thank you, Paulina. I'm afraid, we need to wrap up, so no more questions. I'm very sure that this discussion will continue beyond, and it's nice, that this webinar also, connected so well, the teams working on the parallel projects, so thank you to all who joined us today. And again, great thanks, to all the teams, that presented, and congratulations to all the grantees, for your impressive work this year. So thank you very much, and I announce this webinar closed now. Thank you.
And thank you, Robert.
Thanks a million, Robert.
Bye-bye.